The Rutgers Equity Alliance for Community Health was established with a fundamental belief that there is tremendous expertise in the community in people who are working on these issues related to social determinants. And there's also tremendous expertise amongst Rutgers faculty. And we believed that if we could bring these two groups of people together, we might come up with better, more sustainable solutions.
This is not about Rutgers delivering an agenda to a community. This is about Rutgers being in a community and learning from that community at the same time that we're trying to teach.
We want it to be long-term, building it into our courses at the university, internships for our students, so that it goes beyond just a semester and leaves resources in the community for years to come.
The notion of social determinants of health actually comes from work that was done in Great Britain around poverty. And what we learned is that if you're hungry, you're not going to have good health. If you don't have access to adequate housing, you're not going to have good health. And if you have poor education, you're less likely to have good health. And so we have come to understand that these are probably the most important aspects of the things that we can change in order to improve people's health outcomes.
Our work at REACH is focused on 5 specific social determinants: education, employment, food access, housing, and population health. REACH is working in the 3 cities where Rutgers has its main campuses, which are Camden, Newark, and New Brunswick. There are also cities that the data shows have poor health outcomes and experience the adverse social determinants that we're focused on.
We received a $10 million grant from the Robert Wood Johnson Foundation to do several things. One of the most important things we're going to do is to take 4 of that $10 million and give it in grants to Rutgers faculty who engage in equitable partnerships with people in the community to address one of our 5 social determinants of health areas.
We have what are called collaborative learning tables. We have community members who are partnered with faculty members, and they're actually working together to better understand what the issues are and how we address them collaboratively.
We've been working with My Brother's Keeper for several years now. Our center convenes the statewide Educational Equity Coalition, and My Brother's Keeper is one of our core partners in that coalition.
My Brother's Keeper sits as an initiative of the Newark Opportunity Youth Network. The Newark Opportunity Youth Network focuses on 16 to 24-year-olds who have disconnected from school and employment, seeks ways to have them re-engage in pathways towards a diploma and workforce development certification. We are currently working on a Winning the Freshman Year campaign. It's data that's coming out of the Cornwall Center that shows that if you're able to target freshmen who are entering high school, make sure that they remain on track throughout their freshman year, it is the best predictor of future success. Dr. Van Deen Campbell came to us at OYN and MBK specifically and said, can we use this quantitative data, couple it with the qualitative data of our experience, and what can that tell us about how to best support young people so that they can graduate from high school?
We are already seeing freshmen on track rates increase by double digits in some of these schools. And when we see freshmen on track rates increase, we expect that within a few years, increases in graduation rates will follow.
It is a natural partnership because Rutgers is part of this community and for decades have been intentional about making sure that they're reaching out to community stakeholders.
St. Joe's Carpenter Society has been working here in Camden for 38 years. We are focused on creating a better community for all of our residents. We do that through building wealth, as well as some neighborhood revitalization. Kathy Newman is the director of the Voorhees Center for Civic Engagement at Rutgers out of New Brunswick. And we've been able to work with her over many years to be able to understand different roles that housing has been playing in the state of New Jersey, whether it was through rent control or through housing and homeless providers, different things that she's been able to research and be able to have conversations with us so that our local residents could inform some of the academic work that she's been doing. It's not simply answering survey questions, but actually having us sit down and truly work through some of the issues and understand together what it is that we could be doing both from the community level as well as the academic level to make a change.
I am a firm believer in nothing about us without us. For too often, we have believed we could go into a community and tell people what they need to do without understanding there is enormous wisdom in communities that we too can learn from.
The people who work in the community, see these issues every day, live these issues every day, have to be part of the work to help create long-term solutions.
When I think about REACH and its future, wherever Rutgers is planted, you are going to see healthy and thriving communities. By training up new generations of young people to think about service to community in a new way, to train our own healthcare providers to listen in new ways to the community that they serve. If we keep doing that and iterating it, its reach will expand.